What's up, y'all? Welcome back to my channel. If you don't know, I am Nurse Lopez, and in this video we will be talking about me getting a new job and how I am overcoming burnout as well as doubt. So if you're interested in hearing about that, then keep on watching this video. So for starters, I am not going to be in this video talking bad about my job or anything at all. I am very appreciative for my job because if y'all watched my first interview video, I think it might have been like my third video on this channel when I first graduated. I was having a hard time, or at least I felt like I was having a hard time finding a job out of nursing school because of COVID and everything else that was going on as like a domino effect because of it. So they were the only job, I think, out of maybe 2 or 3 interviews that gave me a job offer, and I took it. I was interested in trying something that I knew nothing about. I had only learned about it in school a little bit based off of what I read. I've never seen it in real life. I've seen it like in movies and everything. And y'all, it is a really easy job. If you are looking for something easy and in an acute setting, a lot of the time you are sitting down. So if you don't like to be on your feet, or you don't mind some of the things that I kind of find as negatives of the job for me, then this is definitely the job for you. Like, I'm very appreciative that I have this under my belt because not a lot of people can say that they know how to do dialysis. They know how to do or fix all of the complications that come along with dialysis and all of that. So the reasons why I'm leaving is because mainly it's the on-call. Y'all know I've been complaining about the on-call since like the beginning, and my manager and everything was aware of that, but I mean, it comes with the job, so it wasn't really much that I could do about it, but to just do it and move on. So within the time frame of this video, and I think the last video I made was orientation, or maybe a few weeks after orientation when I was charge nurse or something, we have been really short staffed. And this isn't the short staff the floor nurses have. With dialysis, you have patients orders that you have to run dialysis for in a day, and regardless how many nurses and stuff you have to run the patients. So you're there until all of the patients are ran. And so technically, on our schedule, it says that we're scheduled for 10 hours a shift, but most times we're there between 12 plus hours. And sometimes 2 patients can take 8 hours, sometimes 2 patients can take 12 hours, and sometimes it could take 16. Just depends on if you have any delays, or if you have any complications that makes it get pushed back. So if they clot or anything, or if you're waiting on a line and say you're on call and now you got to do a 3rd patient, that could also tie into that, or just add on top of that. We don't have set hours, and that's another thing for me. I have been doing it long enough. It's almost a year. It is April now, and in June will be my year of being a nurse and a year as a dialysis nurse. And I have just learned over time that the on-call is not for me. The varied hours is not for me. I need a set schedule. I don't want to have to leave and come back. And I think that's about it. And I need more time for school. A lot of y'all didn't know, but I'm finishing up my RN to BSN program right now. And afterwards, I plan to start my nurse practitioner program. I haven't decided if I'm sitting out a year or not yet, or maybe I'm just going right into it. But I need more time to where I'll have time in order to do my schoolwork and do my preceptorship stuff, because it was a struggle getting my preceptorship hours done for my RN to BSN program when I'm working 4 to 6 days a week. And then on top of that, being on call. So even if I thought that some days I could have just left for like right after work. I couldn't because I'm on call. So I decided to go per diem with them, and for a per diem I am only obligated to work 4 shifts a month, 3-day shifts, or I could do 6 half-a-day shifts, so basically 1 patient a day for 6 days, or 2 patients a day for 3 days and 1 Saturday, which I don't have no problem with. That's 4 extra days that I would have to work on top of the 3 scheduled days I would have to work at my other job. So with all of that being said, y'all, I am burned out. I've had, so sometimes most of the weeks that I've worked up to this point, because we're so short-staffed, or just because of our census of patients have been really high, I work about 60 hours a week. And usually it wouldn't be a problem, but if I wasn't on call on top of me being there super late, then it wouldn't be a problem. But y'all, I'm just burned out and I needed a change. So that's kind of where this whole thing came up from, like why I started applying for other jobs. And for a long time I had put it off because I struggled the first time finding a job. So I was thinking, okay, I'm gonna struggle again, and like, why, when I already have this job that I could just stay in? It's easy. I've been doing it up to this point. I kind of know everything like about it, everything that could happen, I've possibly seen or had to deal with. So I've kind of settled in my comfort zone, and that's not always good. I mean, I always plan to leave, but or at least find another job that I can get my experience that I wanted, and that's what I'm planning on doing now. But yeah, y'all, I'm burned out, and hopefully going per diem I can keep doing this while also learning something else to a whole nother position. So when it comes to overcoming doubt, like I said, one of the reasons why I've kind of settled up to this point and not apply for other positions is because I've doubted myself, like the type of nurse I am. Like, I know I'm a really good nurse, I'm a good teacher, I'm a good learner, like I'm a fast learner, I love to learn. Like, I'm not afraid to ask no questions because I want to make sure that I know what it is for future references or future situations. Like, I like when I learn something and I'm able to just do it on my own without having to go ask people stuff, or I'll just do stuff out of my regular job description to help better me and my position. But I've doubted myself because like the first time I was having a hard time getting job offers. So I'm like, okay, just because I've had some experience doesn't mean that that'll change. And that's kind of put me off. So I would always say, yeah, I'm gonna just wait like to my year, because maybe then that'll make me look even more like better to the hospital recruiters, because now they're looking at me like, okay, she got some experience, even if it's just dialysis, because I work in an acute setting. So I still deal with a lot of the like complications and the acute patients rather than chronic. So I'm pretty good at like emergencies and all that type of things. So that kind of adds on top of like my resume and how they see me when they first read my name on that resume. So I always wanted to just wait till June, wait till May at least. And I'm happy that I finally like started applying, because y'all, my confidence has like went all the way up. And I'm gonna tell y'all, I applied for almost every job that I saw, that even if I don't necessarily think that I'm interested in it, depending on what it is. It's some things that I have a pet peeve about that I don't want to work with, but it's also a lot of things that I don't know if I want to work with or do in my nursing career. So I applied because, I mean, I can learn it, try it, do it, and if I don't like it, I can find something else that I can try to see if I like it. So I applied for almost everything, y'all, because I just wanted like people to reach out to me, like to see my resume and be like, oh, okay, she might be somebody that I'm interested in having working at my hospital. So I ended up getting quite a few emails back, even though I did get quite a few emails from Indeed or the specific facility saying that they weren't going to continue with my resume or my application and stuff. And this time I wasn't even hurt, because even though I doubted myself and was like, okay, why would like anybody want me, or like the first time nobody wanted to offer me a job or even like take my application to the interview process. I know I'm a good nurse. Like, I do what I'm supposed to do. Like I said, I'm a good teacher. I continuously improve myself, like my job. I work good with my patients. So it's like I have all of the characteristics for why jobs should hire me. So it's like, okay, if they don't want me, then I mean, they probably have other people that have better qualifications than me. So it is what it is. But the same amount of like rejection letters I was getting was the same amount of people who I was getting reaching out to me to set up an interview. And if you have not checked it out, check out my interview video, and it is from when I first started this channel. So if y'all think I should make an updated one, let me know in the comments, and I can probably do that for y'all, because a lot of the questions that they were asking me were the same questions, and I've learned how to perfect my answers without like having to lie. Like the first time, it was very hard for me to like use experiences for my answers because I didn't have that many experiences in nursing school. But now I've had to deal with so much as my time as a nurse. I knew my answers right off the bat, even if it wasn't like questions I prepared for before the interview. I knew how to answer them as soon as they asked them. So yeah, so I was getting a lot of interviews and everything. Most of them were on the phone. I think 2 of them were in person, and then the second round of interviews, I just had to go like view one of the hospitals, and I just went to each of the units that I had applied for just to see the hospital and how the unit is and like the people who work there. So I think I had 3 med-surg position interviews. 2 of them were at the same hospital. 1 was at another hospital that's further away. I think a PCU position at the one hospital, the vascular access center, and then a MICU position. So I'll tell y'all at the end which position I ended up going with, but I was really interested in the MICU because I work with a lot of MICU patients now. So I've kind of feel like I see most of the stuff all the time, and I always just been like, okay, I want to be able to do the stuff that ICU nurses do. Like whenever the patient's oxygen saturation and stuff drop, they know like to call the doctor, and like they know about the PEEP and expiratory rate and Valium and all that type of stuff. And I just feel like I want to be able to like do that. Like I want to be the best nurse that I can be and know the most amount of information and knowledge that I can have. And I feel like ICU nurses are that. And I've also seen patients who go into ICU really bad and come out like improved, but I've also seen patients like reverse, like they go into ICU good, and then a lot of them are COVID patients, I have to add, but still, and they don't leave until like they pass, which is really sad. And that's partially the reason why I decided to not go with the MICU position right now at this stage of my nursing career, because of the death and dying. Like, yes, I deal with a lot of death and dying and dialysis because I have a lot of COVID patients, but it's different when they're your direct patients versus when you go run a patient leave and you just know that, okay, every Tuesday, Thursday, Saturday, you're running this patient, and like, yes, you talk to them and everything, but it's just different when like your own patient like dies. So I decided not to go with the MICU position. And then one of the med-surg positions, I I don't know, off the bat, I just felt like really like inspired, and I felt like the facility would really help me. The manager would really help me get my experience, get the knowledge that I needed. Like she was saying how since I'm still kind of newer and I don't do like IV access and everything, she was saying how during my orientation, if I feel like I need it, she'll send me to the ER, and basically I do IV access all day until I feel like I'm good at it, and then we can move on. Or if I feel like I need my orientation process to go a little bit further week-wise, we can do that. Since it's a telemetry position, she was saying she'll let me go see ECMO machines, open heart surgeries that she could probably get me into with the doctors. And it was just like, if y'all hear somebody telling y'all that, of course I gotta make sure that she does it, but just off the bat, like I felt like I would get a lot from that job. So then the other two med-surg positions at the other hospital, I was interested in those two, not at first, but when I went to the actual hospital, for one, the hospital was really nice. And then one of the units were a little older than the other ones, you can tell just by the way that it looks. And they had just built the other one, and it was a magnet hospital. So I felt like, and a teaching hospital, even the other one. But I just feel like with me being newer, they'll be more receptive to me being like a new nurse, and they'll be more receptive to me being needs to be taught and whatnot. So I was really looking at all of those positions, especially after I did the walkthrough through the units. But it was just the culture difference between that hospital and this hospital for the telemetry position was definitely a difference. Like as soon as I walked in this hospital, I could tell that the culture was and the diversity was a lot different than this one. So I did end up going with the telemetry position, and I picked that position because of that. But I work with a lot of, like with dialysis patients, a lot of them have like heart issues and like heart syndromes like AFib and atrial flutter and blood pressure problems and everything. So I feel like, and even in college, that was one of the things in nursing school that like I knew I aced. Like I knew everything about the heart, I understood it, how the medications work for the heart and everything. So I'm really interested in the heart, which is why I chose to do telemetry. So maybe later in life I'll try ICU or like a surgery position. I'm not gonna say never, but I don't know how long before I would want to do a clinic position. To each his own. I know some people, I did a poll on Instagram, and some people were saying how like no, they would never work in a hospital, they only want to work in a clinic. And I mean, do what you gotta do what you feel like is the most comfortable for you, most interesting for you, because you gotta do it for the rest of your life. You cannot just take everybody's word for it, and just like you'll be miserable, like you'll get burned out. So do what's best for you. Like that's the main thing for this whole video, is do what's best for you. And if you gotta leave a job and move on, okay, and go find something that you do like. And if you don't like that job, stay for a while, like learn what you need to learn, do what you need to do for them. But if it just comes to where it's like you're dreading it every single day, complaining all the time, you feel like y'all so short-staffed to where now you having to do triple the work and so on and so forth, y'all get another job. Like I don't know, but that is basically the end of this video. Like you have to have confidence in yourself, and even though I've never been a really confident person, I have really, through my year, I've grown so much, especially as a nurse. So I am very happy to make this video. And if anybody has any questions, if you are interested or excited to hear about my next journey in my nursing career, make sure you like, share, and subscribe to this video and to my channel. And just keep on watching, because I'm about to have all the videos coming about all of my experiences, about how my orientation goes, and about all of that. So y'all just be ready. But yeah, thank you for watching my video, and don't forget to like, share, and subscribe to my channel. And my Instagram will be at the end of this video, so don't forget to follow me on there as well. Bye y'all.